So I've been diagnosed with lupus. So I was diagnosed fully in 2012, when I was in England then. Um, but if I go back as a child, I've always been a sickly child. So, um, at least from the age of 7, I've had one ailment or the other.
Hello and welcome to Authentic Travel Podcast. I am your host, Abiosonia Ebenezer Baruch. I am an investor in positive transformation through counseling, life coaching, speaking, and also writing books. Have you read my book yet? Inner Harmony, Resilience Beyond Chronic Stress and Burnout. This book is available on Amazon and also on my website, www.asebconsultancy.com. On this podcast, we talk about our mental health, emotional well-being, and also our holistic well-being in order for us to thrive authentically. This is a safe space for you to speak about soulful truth and talk about the things that will help you to come back to yourself and regain your self-awareness. Welcome to the Authentic Podcast once again. So, on today's episode of Authentic Travel Podcast, I am going to be having a very lovely conversation with Ije Asike. I hope I pronounced that name right. If I bothered your name, Ije, I'm so sorry. So I'll go with the lovely Ije, and I think it would be best for her to introduce herself. But one thing that I know she might not mention, she's also um, currently working on a PhD, right? I know she might not mention that, but I think I will just throw that in. So I'm going to let her introduce herself because I'm super excited about this discussion. So IJ, thank you so much for honoring my invitation to share with us your experience and also to just talk us through certain things that we don't know about what we're going to be discussing today. So I'm going to just allow you to introduce yourself and then we just dive in.
Okay. So my name is EJ, and people call me IJ. So the full name is Balum, but it's a bit of a tongue twister. So everyone calls me EJ. So Ije Asike. Um, so I live in the UK. I'm a therapist, by profession. So I see people with different mental health issues and give counseling sessions. And as you mentioned, I'm currently doing my PhD too, at the University of Greater Manchester. But besides that, I'm also a mom, um, and also a daughter to a very adorable mother. So that's me in brief, and maybe as we talk, we'll get to no more. So I'm in full-time PhD, and I'm also practicing as a therapist at the moment.
Fantastic, IJ. So today's conversation is a very personal one,
Mm,
and it's going to be based on your diagnosis of lupus and your journey from then. So I'm just going to allow you to lead. If you could just tell us how this started, your journey, and then we will just have to es- to kind of unpick whatever it is you're going to share at
mm.
different intervals. So
Mm.
over to you.
So yes, so I've been diagnosed with lupus. So I was diagnosed fully in 2012, when I was in England then. Um, but if I go back as a child, I've always been a sickly child. So, um, at least from the age of 7, I've had one ailment or the other. Some and most of the times they were not diagnosed. I've had seizures, and doctors wouldn't know what was happening to me. Um, I have joint pains that I'd had joint pains that would make me unable to walk unaided for months. Like when people come to my house, I'll be maybe kneeling or holding the wall to walk. I'll have someone take me to school and I'll sit in, you know, joint pains, unable to even to like I'm a Christian and I'm a Catholic. So normally when you go to church, there are certain times in church where you kneel, and I couldn't kneel. And some people would say, "Ah, the small child, why can't you kneel down in church?" And it was painful, but no one knew. And also, then when things are unexplainable. I can remember having stomach aches then, and I'll be screaming and crying all through the night. And you can like hear people like saying, "This child, you want to kill your mother." I've actually had some relative come to the hospital and tell me to my face, "Do you want to kill your mother?" and all that. And I know it comes from a good place, but at that time also I was also like a child that was confused, not knowing what I would wake up to,
Yeah.
So it's been like that, seizures, joint pains, joint clicking, heart palpitations, different, like all through my childhood. I think I had a bit of respite from, at a point I was in boarding school
Yeah.
and I was always going home because there was always something. Like I'll be in boarding school 1 week, I'm back home, I'll get reoccurring typhoid fevers, reoccurring malaria, reoccurring things that are unexplainable,
Mm.
that you can't really say, okay, this is what is wrong with this child. You keep on going for tests, barium meals, um, and I can remember one certain time, um, I was actually doing oil,
Wow.
palm oil.
Yeah.
Yeah. Um, I didn't know, as a small child, you just one morning and noticed that I couldn't explain what happened, but it was just palm oil, and we went to the hospital. I don't know that one, it resolved itself, but all those things, were just happening as a child. But I had a respite from my SS3 um to uni days. I didn't have any. I was just having like malaria. I know when it's cold, my fingers get swollen. I catch cold easily, but nothing major as I had as a child. I was always having one thing or the other, either lumps or. But then it was just like, okay, maybe it's just malaria and all that. Nothing major, just those swelling fingers. And I was feeling like I always had clicking joints too.
Mm.
So, but I wasn't, it wasn't bad that I couldn't manage, or it wasn't noticeable. It felt like one of the things you get when you're in Nigeria, malaria, typhoid. But then I felt okay, you know. I knew I was sensitive to so many things like food, um, but it wasn't out of the ordinary, as I'll just say. So I would say that period in my life, SS3 to my 4 years in the university. So that's like 5 years. I had respite. Like no one was saying, "Oh, she's sick" or "she's that," and it did feel good. Like, and I know like people will say, "Oh, I hope you're no longer sick. You used to be very sick when you were young.
Wow.
To be very sick. I hope you're no longer sick and all that." And it did feel good. But however, things changed. Um, So I moved to England in 2009 to do my master's. Um so I was okay. It's just like life going on. But I noticed that sometimes after work I feel enormous pain, you know, and my whole body will be aching after like eating like you literally say. So like everyone say, "Oh, change of weather, you know, change of environment. Take paracetamol at the end of the day, so after work, change take a paracetamol. And I would do that. Wake up the next morning. I could wake up fine. Then at the end of the day, I noticed I'll be limping. Finger swelling, dry throat, like so dry that it feels like I'm suffocating, like
Mm.
something is my throat is tightening. So in a sense, and even when I talk, would notice my mouth is dry.
Right.
So I would always like take water, have water handy to like just get my throat, you know. So that was things that were happening, chest pain, and I visited Nigeria. So before I visited Nigeria, um, I complained of chest pain,
Mhm.
and my mom didn't want me to go to Nigeria. So she was like, you should really get that checked out. You should get that chest pain checked. I went to the GP. I had a chest X-ray, and seeing the GP, I also told the GP that I had this clicking joint and painful joints.
Yeah.
Sometimes all of a sudden my arm would just start shaking uncontrollably. So, and I told him that I've had this for a while, that like internally, sometimes you have internal conversations with yourself.
Yes.
And I was saying, I wish that I hope I don't have any cancer of the bone, because it
Yeah.
was something that was particularly concerning for me. However, because of my history of being sickly, sometimes you suppress things.
Yeah.
Sometimes you just I don't want to go back there, you know?
Yes.
Um, so, but in my mind, subconsciously, I've always like, this is something that my joints are always clicking. I think there's something really wrong with my bones, So I was just didn't think he would take it seriously. Um, but he said, you know what, I'm going to send you for a test.
Mhm.
So he sent me for that test, and a few days before I travel, my mom was like, check in with them. So I said they didn't call me. So if they saw something, that they would have called me. So I called the receptionist just because of my mom, and I said, oh, I did a test a few weeks ago. Is it out and all that? So she said, oh, everything is fine. So I was like, okay, fine. So I left. But on my way to the airport, I was now going back to Nigeria. I got a call
Yeah.
from my GP saying that I need to come into hospital immediately. Um, but I was already on the train going to the airport. So, and because it was the underground in London, there's service call. But I was like, I can't turn back, and I just couldn't call back. But she was like, the doctor says you need to come into and see the GP now. And it was not like later, she was like
Yeah.
now. So, but I couldn't go back. So I went to Nigeria. Um, But as I went to Nigeria, I was still having all those things. I went to see a doctor in Nigeria, and I was saying, oh, this is the things that I'm feeling, my
Yeah.
fingers, my joints. And he was like, oh, this, like, it looked like rheumatoid arthritis,
Right.
you know. Um, so I just walked to him casually and we spoke about it. And why I actually spoke, because that period I went to Nigeria, I had a friend. My my friend's wife, then I visited her when I went to Nigeria, and she had this weird ailment, and they said it was rheumatoid arthritis, where she wakes up sometimes with a swollen face. Tomorrow she's fine, and when I came, she was telling me all that had happened to her. That now she goes for steroid injections and all that. That her fingers will swell up and her face will swell up. And like when she spoke, when someone is speaking and it feels like you're the one speaking.
Mm.
So she was talking, and I was like, oh my God. Like then I hadn't started having felt face swellings. But every other thing, like the pain, the finger swelling, the joints
Yeah.
clicking and all that. So so many things that internal heat to say if my body is burning up and all that. Everything she was saying, I resonated with it. So, but she said she was diagnosed with rheumatoid arthritis. So I think after having that conversation we had, that made me when I went back to Lagos, because she stayed in the east. When I went back to Lagos, and I went to see that doctor and said, okay, this is this. And I didn't tell him I had a conversation with a friend, but I just said, and he said, oh, it does sound like rheumatoid arthritis. If it has to do with your joints. So that happened. And I was just getting along with myself in Nigeria and all that. It was when I got pregnant that I decided to come back to England.
Okay. You know what you said you went to Nigeria, right? What was the gap between you going to Nigeria? And also, before you answer that question, I was just wondering if you could explain to us what is lupus?
Okay.
Because some people, they're like, lupus, what is that? We are not going to assume that all our listeners understand what lupus is. Even
Mm,
malaria, not everybody know what malaria is,
mm,
right? Because in this country, they say they do not have mosquito. So when you tell someone that, oh, I just went to Nigeria, when I came back, I contracted malaria, they're like, what's malaria?
mm,
But to us, we know what malaria is because we have mosquitoes all over Nigeria, right? So I'm just wondering, what is lupus? And also, all the symptoms that you gave, it just seems to mimic a lot of other conditions. Because when you were describing it, I was like, it sounded very much as if you've got sickle cell, like
mm,
SS. We were talking about those things. It
mm,
sounds like when they have crises and the different things. I'm like, are you sure it was not a sickler case?
mm,
But it's not that, is it? So it mimic other things. As we were talking, I could just think that, oh, it sounded as if it was that. But at the end of the day, she's calling it lupus. So please, if you can first tell us what lupus is, and then let us know the fact that it mimic a lot of things. And it took so long for it to be diagnosed. I
mm.
think it's based on the fact that it mimic a lot of conditions. And also, if you can tell us the space between you receiving that phone call on your way to the airport and then coming back, let's know how that's, And then they also mimic rheumatoid
Arthritis.
arthritis. So you can see that confusion there. And I do apologize to the viewers if you see me um, dabbing on my nose. I've got a bit of cold, so I do apologize if that's off-putting for you. So over to you, AJ.
So, lupus is a chronic health condition. Yeah. So it's an autoimmune disease whereby your cells, so where your cells are meant to protect you. Yeah. Protect you from diseases, infections, and all that. But it now attacks your internal organs. It attacks itself. It attacks your body. It attacks anything. So it's chaotic inside your body. So we
Mm,
cannot identify that this is a good cell.
mm,
So that's why it attacks your kidneys, your skin, liver, heart, um, all that. So it's an autoimmune disease where your cells cannot identify which is a good. So that if I put it like normally, so if your body is a country, yeah,
yes, yes.
um, and there is war,
Right.
the soldiers are unable to say, "Oh, this is our team.
Ah,
This is my people," or no, it fights its team. So
mm,
it fights the same people that is meant to be protecting you. It's fighting it, it's attacking it.
right.
That's how I can make it just like simpler for each and everyone and say our cells attack our bodies.
Yeah,
That is what it is. So our
right,
cells attack each other, they fight each other, they don't know between that this is bacteria and this is a good cell.
right.
This is what needs to be fought off, and this is no. It just goes haywire and attacks everything that it lays its hands on. So
Wow,
that is what lupus is.
yeah, that really sound very chaotic, like you describe it. Is it genetic, or is it can you infect someone, or is it something that you can be infected with, or is it, is it
Mm.
genetic?
So, um, as far as we know, it is not. You cannot contact, cannot get it from someone. You hear people say, "Oh, can it be infectious?" It is not infectious.
Yeah.
Yeah. So the thing is, people are genetically disposed to have
Oh,
lupus.
right.
So there is a genetic disposition to have lupus. But
Right.
I think we'd also touch on the fact of where we talk about ACEs, yeah, adverse childhood experiences,
Oh,
suppression of emotions. Um, I think if you read the book of Gabo Mate, we talked about how suppressed emotions
is
can
that the body? Is that
actually,
the body keep the scores?
and in most of his books, he is a key person that talks about the fact of when emotions are suppressed, it can come out in forms of chronic illness
Yes.
and stuff like that. So when you're also genetically susceptible to a chronic illness, things like your environment or things you're going through in life can trigger that disease to go full blown. So in a way, it's like a sleeping giant. When something now wakes it up, it goes. But sometimes we we don't know the psychology behind all those things. But there are people that are genetically disposed to diabetes, chronic illness, all that, lupus and all that. So lupus is part of that illness that people are genetically disposed to. And it falls under the line of, so when we talk about arthritis, so because of the joint implications, so you can see, so it's the easier thing to like people to shift it to rheumatoid arthritis and misdiagnose people with rheumatoid arthritis,
Yes.
while it's lupus that it affecting them. So that there is a genetic disposition to that.
Right.
Being said, there are also people that can have neonatal lupus. So lupus triggered after childbirth,
Right.
have lupus at birth.
So that
So
is that the mother or the child?
so some can have lupus after childbirth.
Oh wow.
Some children can have lupus when they are given birth to anito cleft. So it depends. But the majority of people have that predisposition to having lupus, but it cannot be. So you can't get it from touching somebody.
Yeah. Okay.
So it's not transferable. It's not a disease that can be contacted. Rather, it is the person that has lupus that is predisposed to getting any infection, because your
Mhm.
immune system is that low that it cannot fight off any disease. So the person with lupus is more cautious of catching something
Right.
and giving something.
Right.
Yeah. So if you're like a young mom and your kids go to school, and once kids go to school, they come back with a lot of stuff. So anytime there's a seasonal viral stuff, they come back and you take it in. So you're prone to catching more infections than any person. Not just because of your lupus, but because of the medications that you're taking that
Yeah.
also suppressing your. So we have these medications called immunosuppressants.
Right.
So they suppress your overactive immune system.
Right.
Yeah.
Oh,
So our immune system are overactive. That is why they affect every part of our body.
wow.
So
Okay.
when we take these medications called immunosuppressants,
Yes.
suppress your immune system and even make you more vulnerable, to infections.
Right. All
Yeah.
right. Thank you so much for explaining that. Right. So now I'm just wondering, in Nigeria, did they not do tests? You know, from because I'm just thinking about from when you started being sickly till the diagnosis. What is the gap? At what age did they diagnose it?
So I was diagnosed when I was 26.
Wow,
Yeah,
that's like 20 or 19 years.
yeah. I
That
was
must have been
diagnosed.
emotionally draining for you, your family, and
It was when I was diagnosed that my mom was like, it might have been lupus that have been happening to you all those years that no one knew. There'll be like, keep praying for her. You don't know what's wrong. I think there was a time when I had seizures. So when they took me to the hospital, like they'll take me to the hospital to UNTH, I think my mom was fervent that everything that happened to me, I had to go to the hospital. So she didn't take anything for granted. So take me to the hospital. And at the point, I felt like the students would come, medical students will be around, and the doctor wouldn't know. They would do ECG, they would do this, do that. They wouldn't see anything. Um, and the doctor once asked me, so they tell us what is wrong with you. You know, that's how like confused.
wow.
Yeah.
How are you supposed to know? You've not gone to medical school or something. How are you supposed to know that? They probably reached the end of themselves. They didn't know what to say anymore. Okay. Now, for anybody out there, if you know you're going through this condition, IJ is going to be leaving some information because she's doing research about it, to see the medical side of things, the emotional side of things. If you listen carefully at the beginning, she also said she was a therapist as well, right? We know that this condition will be emotionally draining, mentally exhausted, will be financially draining as well. So it kind of tap into the very core of our essence, if you may say. So if you're triggered by this, please reach out, send us an email, or look into the information side of where you're watching from, whether it's from YouTube or from any of our podcast platform. There will be useful information there for you to get appropriate support. Or if you have questions for IJ, because we're going to organize a session where she'll be coming with someone else to answer your questions. So please don't just leave it like that. Send us questions. And I'm sure the email that you can use will be rolling across the screen for you to send us an email, and also look for information on the description box. So back to you, IJ. So I'm just wondering the emotional roller coaster
Mm,
your father was going through, the emotional roller coaster that you are going through because you are very young.
mm,
Ah, nobody teaches us, even as an adult, when things overwhelms us, it's like all the things that we learned, you kind of fly through the window because the amygdala has taken over. I'm just wondering, how did you cope before you jump into the other questions I asked before? How were you people coping with all of these things? I know you mentioned prayer as well. I know Catholic, you guys use the roses and all of the stuff, and you get other people to also join you. I'm just wondering,
mm.
how did you cope? For someone that is at this stage, I'm just wondering, how did she cope? How did you cope? Please, if you can share with us.
I think um so my it's the coping part. But I think my mom, so I lost my dad when I was 9 months old.
Oh,
So it's just been myself and my mom. My brother died sooner after the death of my dad. So it's been my mom and myself.
right.
Um, I think faith helped a lot. That's an undeniable factor. Um, back in Nigeria, there's nothing like therapy. There was nothing like therapy. It was just that prayer, asking God to heal you, asking God, I want to be normal, I want to do what other people are doing. It's just that prayer. I think that was it. But I also had a good relationship with my mother, you know. Um she had she was praying too a lot, because it was just too much. I think as a child I was so dependent on her. I didn't feel much. I felt the trauma as people made comments, but I had my mom, you know. I
Yeah.
think more was as an adult, you know.
Yeah.
You know, when I said that phase of being independent, not having any illness and
Yeah.
growing and doing what every other person is doing, finishing uni, doing your NYSC, trying to get a job, leaving the country, you know. So it was just at that moving stage, you know, doing what your age mates were doing, um, until lupus now came,
Yeah.
you know, and as I'll put it, life stopped,
Hmm.
you know, life stopped. So you moved from a place where at the stage in your life you're meant to be the one caring for your mother, you know.
Yeah.
So you know our African tradition is you finish uni, you start working, you become financially responsible and start supporting your parents.
Yeah.
Yeah. But I couldn't, no. I wasn't physically able to. Um my kidneys were affected. So part of my symptoms were it affected my kidneys, my joints, my skin. I developed Raynaud's. My kidneys were the first.
Yeah.
My kidneys were leaking protein. Um, and they had to do, so I had a kidney biopsy. I was swollen. Like I
Wow.
was practically swollen. My feet couldn't fit into shoes. I had to wear Crocs because that's the only thing that can fit my foot.
Yeah.
And I'll have to elevate my feet. I had to reduce the fluid intake.
Yeah.
You know, if you look at me then, you would say I'd picked up on voodoo.
Wow.
You know, it was just unexplainable. I remember that when I had my son, um, a few I knew I was having a lot of pain, you know, but I didn't know it was because when I got back to England, they couldn't do anything. So the main purpose why I came back to England was because of that phone call on the train.
How long did you stay in Nigeria before you came out to England?
Nigeria in April, I came back in July.
That's 3 months.
Yeah.
Hey, EJ, you are brave. You had a phone call that said you have to come. You still went to Nigeria. You did not just get there. You stayed 3 full months. What happened? Were you not worried at all? Like, what was that? Because those phone calls, you and I know they don't just make it because they want to joke. When they make it, they are serious.
Yeah. I I was in my prime,
Yeah.
you know. You know that sense of I'll rough it out. What's the worst that can happen? I have a mission to go to this Nigeria. I had my mind made up. However, and I think is also God, you know.
Oh,
Sometimes in life you pray, you pray, you pray, you fast and pray for something, you pray, you pray, you pray, you pray, you pray. And when God is not answering, you think he's not answering. He's answering that prayer, but he's not giving you what you think you to what you crave, you know.
yeah.
He knows that's not right for you. But he answers your prayer,
Yeah.
but he gives you the best for you.
Yeah.
Yeah. So going to that Nigeria, I had my prayer intentions and I was praying for that, praying, 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 praying. But when I became pregnant, I had to, let me say, small sense came into my head. Yeah. So that sense that came into my head, because now it was not just me. There was
Yes.
something else. So I had to now think, oh, there's someone else relying on me.
Yeah.
And I no no hard feelings in Nigeria. I didn't trust it. I just
Right.
didn't trust the medical system. Um, but I was grateful that I had the option.
Yeah.
So I had to take that option because at first I was like, oh, that's a big, you know, I'm young, I'm strong, but
Yeah.
once I got pregnant, no, there was no plan B.
Right.
I just knew, and I just knew then that the only plan was to come back to England and find out what is wrong with me, not to guess, is it rheumatoid arthritis?
Yeah.
Is it what it is? Is it typhoid? Is it malaria? Is it, you know, so that made me come back. So in that space of 3 months,
Yeah.
I came back. I left everything. I got a job in Nigeria. I left everything and just
Yeah.
came back. So, but when I came back, the doctors were like, they can't do anything until I have the baby. Then they can now pursue what it is that is wrong. Because I also changed GPs. So before the GP could find out, okay, there was they sent me a letter. So when the doctor called me, they
Yeah.
actually referred me to a rheumatologist. Wasn't in the
Right.
country, so all that. So they just said to me, you know what? Have the baby. When you have the baby, we'll refer you back to the rheumatologist. Um, so that was, yeah, it was,
Ije, just a quick question. What's a rheumatologist? I like to simplify things so that
yeah. So they focus on rheumatic symptoms and musculoskeletal diseases. So those
uh,
joint pains that we get. So
right.
like things like in internal organs. So they get that. So most of the times they're the first point of call and they now send you out to nephrologists, cardiologists, pediatric surgeons.
Yeah.
So with chronic illness, sometimes they're the first port of call, then you now get sent off. But they manage all those rheumatic symptoms that you have and all those
Yeah.
the skeletal issues that we have.
Fantastic. Thank you so much. So they said they treat a wide range of conditions, including inflammatory,
Inflammatory
degenerative joint
conditions.
disease, autoimmune disorder, metabolic bone disorder, and all of those things. So for people that are listening, that's what it means, right?
Mm,
So your journey so far, knowing that it mimic a lot of things, and you've been diagnosed with it, now you're pregnant, and they have to wait before they can start supporting you and things like that. What is your key message to anybody? Because I know you are doing a lot to draw awareness to this condition that a lot of people seem not to understand. And if you don't understand, then how are you going to be able to support the person that
mm,
has got this condition? And if you've got the condition, how are you going to be able to support yourself? Because one thing, one emotion that I know is even more destructive than any condition is fear.
mm, mm, mm,
When you are diagnosed with any condition and you become fearful, it is very, very possible that that fear can quicken your body to degenerate so fast that is not even the condition that is at work now.
mm,
So when you talk about your faith carrying you through, I really appreciate that because I'm a believer. You
mm,
are a believer. In our faith, we leave it in the hands of God. But Bible also tells us that my people perish for lack of knowledge, for lack of wisdom. So it is very, very important. Even when you are praying, that you say, God, this is what has been diagnosed. I choose not to believe this report. But if you don't even know, your prayer can be disjointed because you don't even know what you're praying for. God, something is not right. And you don't get that faith. Your faith is not stirred up. That's what I'm
mm,
trying to say. Your faith is not stirred up. So it's very, very important that if you have any of these conditions, symptoms that she has mentioned, please go and see your GP. Where people are afraid, we're telling you to pray, but please go and see your GP so that you can get this diagnosis and you know exactly what you're praying for. Now, moving forward, Ije, what is the key message out there? Because I know your PhD is based on this, isn't it?
mhm,
That's a lot for you to invest your time, considering this condition can spoil up any time and give you some challenges. What
mm,
is the key message today that for people that are listening to this? What is the key messages that you want them to take from this, and how they can be part of the survey that you're doing as well?
Okay. So the key message with lupus, so there's this so my study is based on what are the factors that enable people to flourish in lupus. So factors that would enable, if people are flourishing or languishing with lupus. It stemmed from my own story. So for my thesis in the university, other people knew what they were doing. Um I had no clue what I would do.
Yeah.
I would have just done anything just to do that thesis. But as God would have it, He put when God's time, He positions you where He wants you to be.
Yes.
And even if, because my memory is rubbish, for lack of better words, I forget a lot. So imagine someone that forgets a lot telling you that she's doing a PhD. That means when grace is abound, anything is possible.
Yes. Yes.
Um, Patience. So what I drew from my studies, from writing about my story from childhood, and I tell you, when my professor said to me, "EJ, what would you do when you graduate from counseling?" And I said, "Yeah, I'll be a counselor. I'll be a therapist. Have a simple life." I was like, "I think you should do a PhD." I'm like, what am I going to write in my PhD? What do I know that I'm going to be doing? I actually went into my camp, burst into tears because I was like, what, I don't know.
Yeah.
Um, that I just don't want to study again. I still do not want to study. No jokes. Um, However, I drew that there was a process. Yeah. So from my story, there was a process of pain. Lupus is pain. There was a process of finding that spot to accept. And I'll talk a bit about that acceptance. Yeah. When I link it to some things about my study, what I've also found. So, and I'll mention to anyone listening, this is my personal process. So, an acceptance is a point you arrive at. You don't force it.
Mm.
You arrive at it. You arrive at that space where you feel like, what do I fight? I'm not pushing. I need to adapt to this. So when you accept, your level of acceptance determines how you adapt. Mind you, I'm saying that this is my process. Yeah.
Yeah.
And by adapting, you see other viewpoints, you see other perspectives, you, if you look at the light behind my background, yeah,
Yeah.
you can see how the lights are going. And trust me, I'm just looking at it now and it's just making sense to me to explain what I'm talking about. You can see the array of light. It comes from darkness. So let's say pain was darkness.
Yeah.
And it adapts to the atmosphere, and you can now see how beautiful it is. So when you adapt, it enables you see growth. It
Mm.
enables you see the little you can do to make that step in front of the other to grow. So your paths change. If you see that light, is the northern light. See when it moves apart.
Yeah.
I never thought that I would be a counselor therapist.
Yeah.
Yeah, I had other dreams. And life, I think in every phase in your life, you have dreams. You have different dreams. You come
Mm.
and you have different dreams. But when lupus came, lupus stopped me. I paused.
Mm.
And I felt like it was over. So in a sense, you feel like you're stamped and it's it. There was nothing else. It felt like, what else is there for me? Yeah. There are days I can't get out of bed. There are days I'm in so much agony.
Yeah.
I can My mom has to do everything for me, literally everything. I'm in and out of hospital. I will either have um a blood infection and my whole legs are red, like literally red, and I'll be having antibiotics. My fingers are breaking up and pores. I can't use them. I'm going for um joints. So I've had surgeries in both knees and both ankles at the same time,
Yeah.
um, because of an effect of my medications, steroids, and you have a degenerative knee issue. So like now I have a degenerative knee issue. My right knee, my kneecap is gone. So, and there's nothing, I can't have a knee replacement because I'm too young. So every time my bones are loosened, it will be cleaned up. It will continue being cleaned up until there's nothing left and I'll have a knee replacement. So you live with that. However, there is a purifying part of pain I have seen. Um, it's not just the pain. Yes, the pain, I had to learn to accept it. I had to learn to adapt.
Yeah.
Then I had to see life beyond it.
Mm.
Seeing life beyond it. As a therapist, I talk to clients and I say, it's not the big picture that matters.
Yeah.
It's the small dreams. It's the small changes. So by adapting, if I'm unable to walk today, then I accept that I need to walk with my walking stick.
Yeah.
That means I'm able to move. Or if I
Mm.
don't accept it, I'll stay in bed and say, I reject this walking stick. It's not for me.
Yeah.
However, when I adapt, it makes me see that there's something else that I might do that
Mm.
wasn't in my plan before.
Yeah.
So lupus made me sit at home.
Mm.
It made me go to church more often. Then it made me see that, in my church, there were just old people working. There were no young people doing anything in church.
Mm.
If I was in a fast pace, so God positions you where He wants you,
Mm.
even when you're incapable, when you feel physically incapable, He puts His capability into you to make you move.
Wow.
So I noticed that in church and I said, you know what, why not start a youth? Mind you, I have infusions, I have treatments, I have all that. There are weeks I'll be in bed, but on that day of youth group, I will get up and I will drive to church and I'll do my youth group and I'll come back and I'll lay in bed. God gave me that strength.
Mm.
But that would never have been in my radar if lupus hadn't come. And also in that period I had issues with, so like, because of lupus, I couldn't work. So my mom had to apply for me to stay. So I had to be under her. And that application wasn't easy. So we had rejections, had to go to court. So that on its own caused other issues. So the thing with chronic illness too, so I talked about ACEs at the beginning, yeah?
Yeah. IJ, before you start, ACEs for all those that are listening is adverse
Childhood
childhood
experience.
experiences. Okay. Right.
Yeah.
Karen.
So your environmental factors too can impact the disease, can
Yeah.
exacerbate your disease. So at that point, I just had a child. I was dealing with immigration. Am I in? Am I out? So all that mentally just gets everything in you working at an autopilot stage. Yeah.
Yeah.
So it was not just the stress of my kidneys failing or my joints. It was also the stress of what is my immigration status and all that. I
Yeah.
can't go to Nigeria. It's a no. It's a death penalty. All those things. So it exacerbates that. However, even in that, there was something to look forward to, which is that youth group. I
Mm.
wasn't paid, but it was something to look forward to. It was something but it was God that put it there. So I grew from there. I changed from, okay, what did I want to do? Be HR consultant or, I changed and started working with young people.
Um,
That, that, that's it. Changed. My CV changed from wanting to do HR to working with young. And I had no job. So that was the only thing I did. But I started, I now looked into volunteering. When my immigration thing was sorted, I now started volunteering at a youth group. So you can see a change in faith.
Yes. Yeah.
But that wouldn't have been possible, you know.
Yeah.
And I would also remind people, I am saying this is my story. What the moral behind this is that even in that dark place that you're in,
Yes.
you're like a potato that is focusing towards the light, that is looking to shoot out. So, you know, when we do our person-centered approach, they say
Yes.
there is something within you that is looking for the light outside. Maybe circumstances are not allowing you do it then, but don't feel that that's it.
Wow.
It's
Wow.
not the part you were in, but there's something else growing out, and that's the growth. So my process is that process of pain, accepting that I have pain. It's not going, yeah, it's not going anywhere. I can accept this journey and accept that I'm tired, accept that I lack sleep, accept that sometimes I forget and I do forget, you know, even remind the people around me that even though I soldier on when I have the energy, when I'm spent, I cannot do anything. So adapt to the fact that I need my working aids in handy places just in case anything happens. Because something I didn't mention is lupus is very unpredictable. Yeah. So today I can, like now, I can be sitting here talking to you. And
Yeah.
the next minute I want to stand up, my knee locks and I cannot stand.
It's very unpredictable.
It is very unpredictable. And wake up. So sometimes I tell people you wake up with a full battery. You think you've woken up with, before it's 10, you are on 15%.
Wow. So, IJ, from what I've said here, you've allowed yourself to be very vulnerable in this place. I was discussing with my husband today that with vulnerability, we ought to be very, very careful. Vulnerability is very powerful. However, before you choose to be vulnerable, check in with yourself. What is the motive? What I hear you say now is your motive for doing this, doing all the research you're doing, is to help other people going on this journey with your story, to draw awareness to this disease and let people know that yes, it's there, and especially as a woman of faith that you are praying. But while you are waiting, there's a choice between flourishing and languishing. Now, both of them are a state. Flourishing is a state whereby you you have chosen to concentrate on the positive, and those things will then enhance your psychological well-being. Languishing is when you focus on the negative and whereby the pains overwhelms you. And because it overwhelms you, it's very easy to slip languishing into suffering. Because according to Corey Kills, who is a very good um, researcher on this area, languishing is just it's a suffering. You are running
Mm-hmm.
away from the pain. The pain is chasing you. You are running. The pain is chasing you. And that alone can deplete your energy.
Mm.
But with your case, I don't want this to get construed. When people like, ah, she's a woman of faith, why is she not praying? Why is she accepting? No. She didn't say she's accepting the disease, but she's accepting to carry on with her life, regardless of lupus. You are not going to allow lupus to stop you because you said something before that when lupus happened, your life stopped. But now you have decided that your choices, you are going to flourish. And you are reflecting with the choices that you are making, giving yourself grace that certain days I may not be able to do that. But because of the choices that you're making, you said something very profound that on the days that you were doing the youths, you will find the energy. It's like a purpose. And God has given you that energy to push you forward, to keep doing it because now it is beyond yourself. And that's part of a key element of well-being, of the five keys of well-being, isn't it? Giving. This
Mm-hmm.
time you are giving your knowledge, you are giving your time, you are giving your resources because you are sharing your story, you are letting people know about information. Now, the youth may not have lupus, they may have any other condition, but you are giving yourself to support them regardless of what you are going through. And that in itself is energizing you to carry on. But even though you are doing those things, there are days that you can't. You are spent, you are still going to choose you, and still going to. So that is the state of that acceptance. And that's so beautifully put. I really like it. So empowering that acceptance is not acceptance of the condition, it's acceptance of your life is still going on regardless. And I
But
think that's so powerful.
I'll also add acceptance of the condition because I've had chats with people and they say, no, I cannot accept it. It's not me, you know.
Yeah,
Mm. But personally, I think I've accepted lupus
right.
as a condition, yeah, and I'm living with it. Um, but I've accepted it in the sense that, like in counseling, when you talk about speaking to your inner child and befriending yourself,
Yeah,
so it's part of my work when I work with people and I talk to them about befriending yourself. If I
yeah,
reject myself, see that the space of self compassion is left out because
yes.
that space within me that I'm rejecting is that space that needs compassion to know that it's okay to be tired. It's okay to be vulnerable. It's okay to cry. You know, we can do this together. When you sit through your pain, if we rush out of pain, you always come back. But when we sit through it, we would find that strength to like start healing. So life is a maze. We go through life, the ups and downs of
Mm.
life. You go today, it's hitch free, tomorrow is not. So me accepting that, you know what, I do have lupus. I'll live. So when I have conversations with people like, and I say, oh, and something happens, I don't mention it until something happens, and I say, oh, yes, I have this condition that is lupus, and they look at you. So they look at you, and you're fine.
It doesn't show on the face.
Yeah.
Because I've spoken to you several times. If I was not told about your research, I would never know.
Mhm. It doesn't show in Nigeria. Say they show for face,
I just spoke pidgin English. Say it again, say it again.
and that's where we get misunderstood, and people get tagged as lazy.
Wow.
You know, she doesn't want to work. She's lazy. You know, because even as a child, when you see me, no, you think nothing is wrong with me, and that's why people will say you want to kill your mother.
Uh, you think that they thought you were doing it for attention?
Yeah, sometimes she's an only child. She's a spoiled child. All that. Or she's possessed. Yeah, I got that possessed by the devil. She needs deliverance. All that. But thank God for faith. My mom's faith is very strong. Like she never with that. But we can be mistaken as lazy, not wanting to do anything. Always complaining. Um, but when your body says no, you can only put a foot forward when your body sits right, when you listen to your body. And that's it. With every other thing, there's not just lupus. When you talked about sitting with emotions and assessing those emotions and not excluding, oh, this emotions is beyond me. No, no emotion is beyond us. That's why I said sit with your pain. I think Gabor Mate talked about sitting with, we want to run away from pain all the time, you know, but before gold is brought out, it passes through fire. It is purified through fire.
Mm.
And I always picture that as that pain. I picture pain as like when I talk about the process of pain acceptance, adaptation, and growth, like a dance is not smooth.
Yeah.
You go through that rigmarole and you always come back to a place where you feel like, why me? I also do that. I still do that. There was a day I struggled so much with sleep that one morning I woke up, especially during school time. I woke up, went into my son's room to pray with him. I was so tired. My body was in agony. And we were praying, and I started weeping. And my son was like, Mommy, are you crying? And when I couldn't hold back the tears, and I said, I'm so tired, my body is pain. And I was in tears. That was me sitting with that pain. So I still have it till today. You
Mm.
know, I can be strong, I can be weak. And the our humanity is that it's hard, but it's also simple to know that we're adaptable, we're not boxed, we're not labeled. So there's this book I read, The Power of Letting Go. Um, is John Perkins, and he talked about that accepting that we can be this. I can be confident now. I can also be very shy,
Mm.
you know. Um, and that's the importance of introducing me to me,
Mm.
befriending me. And that's where I say acceptance is where we arrive. If
Okay.
I befriend myself and
Yeah.
like my vulnerable self needs that comfort. That young child in me needs that someone to sit by and say, you do not want to kill your mom.
Yeah. That's a strong statement. I don't understand how someone would think about that and then had the audacity to just spit it out. Disgusting. Very unempathetic. I don't know if that was their motive, but that ain't good to
Mm,
say it out, whatever the motive was. I should begin to thrive authentically. You know, a lot of us will feel we have to wait until something happens before we become reactive. But with this podcast, I'm trying to give you information that will make you proactive so you don't even have anything to react to in the end because you are looking after yourself properly. So, what are you waiting for? If you have been listening, please like, share, comment on anything that resonates with you. This will help to drive our visibility. And also, if there is any other topic that we have discussed that has been a trigger or that you feel you need support with, please visit www.asebconsultancy.com. There is a 15 minutes free consultation link that you can click on right there and book to speak to one of our counselors. Thank you so much for helping to drive visibility to this platform. And also, if you have been listening on Apple, Spotify, Audible, and every other um, podcast platform there, please follow us and keep sharing. Keep sharing, please. Thank you, thank you, thank you so much. Back to the program now. Hi. There's a question I want to ask.
mm,
Since we are both someone of faith, a lot of people like, I would never, even myself included, I would never accept a condition because if I do, it means I'm losing my faith.
mm,
So I know the condition is there. I'll live with it in the waiting season until you get healed.
mm,
However, I'm not going to accept it.
mm,
Do you think that what can you speak to that? The
mm,
place between having faith. What is the difference? Because with faith, he said is the evidence of things not seen.
mm,
It's things hoped for.
mm.
And hope is part of positive psychology, isn't it? You've not
Yes.
seen it, but you're hoping, and that is a strength on its own.
Mm.
Now, does it contradict acceptance? Does acceptance contradict our faith? Can you speak to that? Because it's a bit contradictory. And even myself, I'm like,
Mm.
it just came out for me. I didn't even
Okay.
realize that before.
Okay. Let me start with the fact that so I'm Catholic, yeah, and we have these principles of the cross. You know where they said there is no crown without a cross.
Yes.
So, um, I think what my mom also I learned as I was growing up is my mom will always say, um, "Don't let your suffering go to waste.
Mm.
Offer it up as a prayer."
Wow.
So when I'm like crying, my stomach, you'd be like, be offering it up, be offering it up. Yeah.
Oh,
So it said, accept it as a cross. So my mom will always say that my illness brought her closer to God.
wow.
Yeah. And we say, and I know we have this mantra in Nigeria when people say, it's not my portion. It's not
Yes.
my portion. And I say, whose portion is it? And when you talk about faith and acceptance, if we go to the Bible and talk of Apostle Paul,
Yeah.
it said that God left a thorn in his flesh. So to curb us from pride, God leaves something. So if Christ didn't accept the cross, we would not have salvation.
Absolutely. Absolutely. Absolutely.
He doesn't give us the cross and leave us. So this is now like we're talking about faith and even
Yeah.
beyond lupus. Yeah, we
Yeah.
go through challenges that we do not accept. Okay, let me put it this way. If you say, "Oh, I will not accept this," how about someone that has a severely disabled child? Would you say, "Do not accept it is not your portion"?
Hi. That hits home. That hit home. So regardless of the condition, accepting it does not mean you are happy that the condition is ongoing. It helps you to cope better because you're right. You're not going to reject your child because of their condition. So you have to come to a place of acceptance so you'll be able to be empathetic towards that child. So I'll be able to care for that child. Don't see them as a burden, as a different one.
Yeah. So, but
As a different
it's
one.
always, and the truth is, our acceptance is always questioned. So there's always, so you accept something, like, okay, yes, I've accepted my lupus. And all of a sudden, maybe a week, I'll be going on normally, walking, not needing anything. Then something hits me, you know, and I'm incapacitated. And then I'm like, why? You know, I thought I've gone through this. I thought this, I thought I would not be going through this again. I thought I'm strong enough. And so our acceptance is so in like in it's not how many times we fall or how many times we get up. But the beauty of our faith is that we're never alone. So you know the story of the footprints in the sand. Yeah.
Yes, yes, yes.
You walk and you think, oh, it's my footprint, Lord, where are you? I've been walking. And he says, no,
It's mine.
it's my footprints that are in the sand. So what faith does is that faith enables us, gives us that hope that you're not alone. That even in the darkest of times that it feels like, why me? And I feel that till today, like, Lord, why me? I'm tired. Like that I think my son is used to that word, I'm tired.
Mm.
But what faith does is that faith enables us have that Christ is with us, that He's not left us, that you're not alone. And it's also good to have family. So I would say my faith is because my mom had faith first,
Bless your
and
mom.
she inculcated that faith, you know. And in my downtimes, I prayed because I learned how to pray with her from her. I remember as a child, I'd be like, because my mom would pray, and she means she feels the prayer, and I was like, I'm not feeling this way. I want to feel the way she feels. Um, but at this point, I feel that now. feeling that there's some times when I pray. I was telling my mom that, like, I'll wake up and I can't sleep and I'll be praying. And I felt that, like, I would pray my rosary. And I felt it felt like dispelling things from my body, like things were just leaving me.
Wow.
And is that state of mind of surety that there's someone above you,
Yes.
holding you. So, and when we talk about the transformative nature of pain, is that it helps you transcend to a space where you know that I know I'm in pain, but I'm not alone. And I say this with all sincerity. I still go to counseling. So people should not think, oh, Faith, I go to my hospital appointment, I go for counseling sessions. It's the whole package. And I think, and I say this, when we talk about flourishing and recovery, my recovery came with the fact that I have the medical help. So my healing is not an absence of lupus.
Hmm.
My healing is the fact. So I would say the factors that enabled my flourishing is that I have the medical help I need. I have my family and I have faith. If I did not have the medical needs, so like people I've interviewed struggling with finances to get basic medication like hydroxychloroquine of lupus,
Yeah.
how do I expect them to say I'm flourishing?
Can't.
So when we talk about the Abraham Maslow's law of hierarchy,
Absolutely.
don't hit those physiological needs. How do we expect? So the awareness, like sort of like this friend of mine that will come and talk, the awareness is built to people to understand what people face. Like in Nigeria, people think it's malaria, malaria, but there are people that are going through. You treat malaria and it's not working, and it's like people have lost marriages, people are called witches, people, all those things, but they're just suffering.
Yeah.
The awareness is if there's an ability for to have like a medical facility that people could have access to those medications that can help them breathe,
Yeah.
to be able to say, okay, I can do this job or I can
Yeah.
do that.
Yeah.
If not that my immigration stints got sorted and I started a masters, uh, and a bit of stability started coming, my
Yeah.
body would not have been able to like cope because it was falling apart on different fronts.
Yeah. 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 So what you're saying here now, I'll just quickly summarize. You've talked about the reason you are doing this to help other people, you know, get awareness about lupus, to share your story on how you are coping. I know you said this is your personal coping strategy, but I really do think it can be adapted into anybody's life. So, for example, have a great support system. A support system could be anybody that you trust, right? That will be there for you when you need help. Because you said there are days that you can't really do anything. And what do you do? So you need your support system because nobody is an island. You've also talked about because for you, your mom, your son, have a purpose bigger than yourself. Like those youth group you're talking about, the people you are counseling, that's a purpose, right? You've also talked about your faith. And in your faith, please don't start saying I will not serve God again because it's not answered me yet. Ije has given so many examples today to let you know that we all have one waiting season or the other. No matter how desperate you are waiting for a child, when you're pregnant, you still have to wait 9 months. So be patient with God. It will come true. I love the fact when you said there are days you cannot pray, and then you just do your rosary prayers, and then you can feel things dispersing of you. So some healings can be miraculous, just bam. Some of them might take time. There are so many times you've said in different ways today, but that message keep coming back. Certain times you go through certain things for a reason. And you said this thing has changed the trajectory of your life. There are certain things you wouldn't have thought about doing. As a result of this condition, it has transformed your complete outlook of life and the things that you're doing. So in a way, you're not, I would say you are in alignment with your purpose because you are doing the things that you're changing life every day, right? And you've also mentioned as well, medical support is so important. Our faith is important. Responsible men of God, women of God will still tell you, while you're waiting for your miracle, still take your medication until you get it all clear, right? So the medical support, you are not going to deny that, Father. They've been valuable. And let's not, how would I say that? Let's not belittle the medical support because it is still God that gave them the wisdom.
Mm.
So God gave them that wisdom to also develop all these things and give the support. So it's still God. That's what I will say. If
Mm-hmm.
I'm praying to God for to heal me and I still go through the knife, I will still thank God because you and I cannot take a knife and cut a human being. We will not be able to even cut, let alone even stitch the person back. So for someone to be able to do that because they've gone to school to get extra knowledge, it is still God. That's the way I see it. So those are the things that you said have helped you in the journey. And then your mindset, IJ. I know you've not used that word mindset, but your mindset, it seems you've worked on it over the years. Because for you to be able to get to that level of acceptance that you were talking about today, differentiate it from your faith, that both of them can coincide.
Mm.
Acceptance is not the absence of faith. I learned that from you today. And I really want to thank you for that. And I hope people will catch that as well, right? Both of them
Okay.
can coincide. It is possible for them to coincide. In a way, they actually even help you in the waiting season,
Mm. Mm. Mm.
right? So that myth about saying the acceptance is not, we're not saying we are not happy with it. We're just saying in order for you to be able to wait.
Mm.
Thank you so much, IG.
Thank you.
Your
Thank
research for people to get involved in this research because I really think it's a great cause. And the Nigerian one you were saying, is there things that people can go for me where people can send money to, that people can share if they want to raise aid for people that do not have access to this medical support, not because they don't want it, but because they cannot afford it. Is there a GoFundMe, your survey? I'm going to drop it. Please just tell us so that we'll know how to
you.
support this cause.
So, my survey, you drop it, assesses just, and it's for people. So, if you have lupus, um, please do this survey. It measures, but it talks about pain, acceptance, adaptation. So, all the things I've talked about: acceptance, adaptation, growth, and it also talks about there's this time. So, it's called connectedness, identity, meaning, hope and empowerment. So it gets all that. My purpose for that is to find out what are the factors that enable people to flourish. Are people flourishing even despite their lupus, or are they languishing despite their lupus? And as you said, it's that mindset and saying, what can we do? What is the fact? What do they need? So, like people in Nigeria, the theme there is medical help. If we get that medical help so that they have subsidized payment of their medication, things will be better, families will be together, people are not rejected. You know,
Mm.
so that is key. Here, people will tell you about psychological support, and maybe they tell you you have lupus and that's it. You don't have the psychological support that you get, and still here in this country, people suffer with the fact that it's hard to diagnose. So they're back and forth how many times that they've been told no, you don't have lupus, and they're struggling, you know. Um, so those are the things where we find how do we support. So how do we um help people get? How do we ask for aid? Like in Nigeria, here we don't have the problem of medications.
Yeah.
We don't have the problem of medications. Here, what we'll be talking, because at first instance, I was talking about what's the psychological intervention that we can form to where you put together with mindfulness, you check people on positive introduction, you talk about character strength,
Mm.
and if we can put that together and get an intervention program, maybe, and do a trial and see how it works for people. But when I now started and talking to people like in Nigeria, and trust me, when I started this, I did not have any communications with people in Nigeria. It just happened. Yeah.
Yeah.
It now opened the whole world. But before you do interventions, you need to have basics.
Yeah.
So I have this friend which will she'll come up. She runs a foundation called the Mabel V Foundation. And what she's doing is to raise awareness in Nigeria to see if we can get medical help for people with lupus so that they can get subsidized. You know, when like tuberculosis, if they have free medications, people
Yeah.
with HIV that get free medications,
Yes.
if that is available. I was interviewing someone and she said they couldn't even get medical insurance because they had lupus. They
Wow.
had to sign it on the arthritis because they felt that people with lupus that you would really do get to need that in medical insurance at the end of the day,
Yeah.
you know. And it's not just that, even here. If you say you have certain medical, they would have to, they'll say, oh, they don't cover it. I had to
Wow.
go through go through several insurance before I got my own life insurance. So you can see how it is. So with that Mabel V, and when she comes, she'll talk more about the foundation. Is getting aid, seeing if we can get buys medications for people. So she did an awareness back in Nigeria in May, where she bought medications for people and put in boxes and gave to people. She has a WhatsApp group where once in a while she gives out medications like buys medications like hydroxychloroquine, those basic medications that people need, and
Yeah.
she gives and she needs fund because 99% of the funds that she's using, she's using her own funds
So
to do.
IJ, with all this stigmatization from, I'm sure families that don't understand, because one thing I know that what people don't understand, they tend to stigmatize. For you to go and get knowledge and awareness about that, you stigmatize what you don't know based on various myths that is flying around. So stigmatization from even medical personnel, insurance company, I mean, it's just not on. So with she using her fund, is it possible for her to send a GoFundMe fund
I
where
think,
that should be
yeah,
ongoing?
I think she's in a better position to talk about
I can't
that.
wait to have her on. I can't wait to have her on. I can't wait.
She's in a better position to talk about that, but it's something that is dearly needed because so many times, so many people will call her. I interviewed someone that is doing dialysis. She had kidney transplant and it failed. She's waiting for another kidney transplant in Nigeria and it's costing a lot. Her husband is threatening to divorce her in that state. You know, a few people that are having that dialysis, people have lost their lives because it's deadly. You can lose your life. That's the truth. You can lose your life with it. So doing that and getting funds, trying to raise funds for people. Um, I think she set up. I'll ask her because this lady that is looking for kidney transplant is very important. They're trying to raise funds for her to get this kidney transplant, and if we can put it up there for people to help raise funds for her, it would be really
If you can
um
send the link so we can add it to the description box.
I
So,
would
yeah,
I would send the link. But um Mabel V Foundation, she's doing incredibly well,
yeah,
trying to get the Ministry of Health to help out with people in Nigeria to get state subsidized medications for
yeah,
is life saving. I tell you that if I say healing, that I say that healing is not that I do not have lupus, it's just that I don't have a headache to get my medications.
yeah. Thank you so much, IJ. We are planning on bringing a friend, and if you have any question, IJ is going to come back. She's kindly willing to come back. If you have any question about lupus and how you can support as well, please send your questions to this email. The email is going to be showing on the screen. Send your questions, then I'm going to organize with them and they will come around where they're going to just answer the questions on the podcast again for people to know better. Please kindly share this podcast to someone that you love. Don't just listen and then leave it. Please like as well. Like, share on your status, on WhatsApp, on your social media. And one thing I've noticed, things that does not help us tend to trend a lot. Dance steps and the likes. These are things that could save a life. Please share with your friends, share on your status, support when we share the link is so, so important. I believe in practical approaches to support people, not just talk, talk, talk about it. Do our bit. We can't wait for the government to do this. If you and I and other people around us begin to make those little support, we could just help one person at a time while we're waiting for the leaders to also do their own bit as well. So we don't just cast blame and just leave things aside. Hey, IJ, I really want to thank you for your time today. I really, really want to thank you. I really appreciate this. I have a question for all my guests, right? What are the things that you do to promote, protect and preserve your inner harmony, so that you can live authentically and thrive?
Mm. Ah. Um, I think one thing I've learned um to do. I see people that are very energetic, and I'm like, oh, I wish that I had that energy.
Yeah.
I think I found peace in subtlety,
Wow.
you know, and accepting. I think is just one thing. Um, I just accept each day. Try to be grateful for the day I am up, you know. Um, I sit with myself, so wake up, do my do my prayer before I get up, you know, and just take each day as it comes.
Yeah.
Put one foot in front of the other. And sometimes I'm really low. I struggle really badly. But when I'm happy, I'm happy. I laugh.
I know you do. We've had good laugh.
I enjoy my food, as in being my authentic self, just being me. And I say, in a sense, just befriending myself, every part of me, knowing that there's sometimes feel you're not enough, but those times when common sense comes in, and you be like, you know what, just feel. So and I think above all, I have a very supportive network. As God has, in His own miraculous way, positioned me to have people, not a lot of people, but those people that they matter. They care. If I talk about my mom or my supervisor, like God has been like God has been authentic with me. Let me just put it that way.
Wow, I love that.
So um it's just when I do not have the energy to struggle, I just submit. And in his infinite way, he just carries me, and you're just moving, and you're wondering, oh, oh yeah, I didn't move, oh, I didn't move, oh. But it's just subtle, but it just keeps going, you know. Um, and that's just where I am today. I never knew I would be. Where I'll be tomorrow, I have no clue.
Mhm.
But we just keep going. I
Yeah.
succumb to my tiredness. I think that's one thing I'm authentic with. I succumb to my tiredness, and no praying will pull me out of it until it dispels it. So, but yeah, just be real. Just laugh.
Yeah.
Enjoy every moment that needs to be enjoyed, and enjoy it, and just be happy. And when you can't, accept that you can't. That's
Yeah.
it.
Wow. Ajay, thank you so much.
Thank you.
Thank you
Thanks for
very,
having me.
very much for your generosity, for your vulnerability. I know this will touch a lot of people, and those people that have been stigmatized as well with it. You're not alone. We are not alone. We are with you on this. And IJ and her friends and her network, they are doing all they can to also draw more publicity to this, raise funds, and do as much as they can. So we just need more people to join on this journey and share as well. That will be you supporting. Thank you so much once again. And until I come your way again on Authentic podcast, Driving Authentic Driving Podcast. I can't even get my words out. I remain your host, Abia Sonia. Keep driving, keep living authentically. And remember, God has authentically created you. Okay? Stay blessed and take care. Bye for now.